Which of the following best describes the main purpose of patient triage in a clinical setting? A. To determine billing order. B. To decide which patient is seen first based on urgency. C. To schedule future appointments. D. To verify patient insurance. Answer B. Triage prioritizes patient care based on medical urgency to ensure life-threatening conditions are addressed immediately. When performing venipuncture, the tourniquet should be applied for no longer than A. 30 seconds. B. 60 seconds. C. 90 seconds. D. 2 minutes. Answer B. Keeping the tourniquet on longer than 1 minute may cause hemoconcentration and alter test results. Which of the following is the most accurate route to measure body temperature in infants? A. Oral. B. Tympanic. C. Axillary. D. Rectal. Answer D. Rectal temperature provides the most accurate core reading in infants compared to other methods. A patient's medical record contains subjective data. This means it includes A. Laboratory results. B. Patient's feelings and symptoms. C. Physician's observations. D. Vital signs readings. Answer B. Subjective data comes directly from the patient's perspective, including symptoms and feelings. When collecting a throat culture, the medical assistant should A. Touch the tongue with the swab. B. Swab both tonsillar areas without touching the cheeks. C. Swab only one side of the throat. D. Swab the lips and gums. Answer B. Swabbing both tonsillar pillars while avoiding contact with the mouth or tongue prevents contamination. Which of the following is an OSHA requirement for handling sharps? A. Recap all needles after use. B. Dispose of sharps in a puncture-resistant container. C. Mix sharps with regular trash. D. Reuse syringes after cleaning. Answer B. OSHA mandates disposal of used needles and sharps in a clearly labeled, puncture-proof container. When performing an EKG, the right leg electrode serves as the A. Ground lead. B. Measuring lead. C. Chest lead. D. Left axis lead. Answer A. The right leg electrode acts as the ground to stabilize and reduce electrical interference in an EKG. Which vein is most commonly used for adult venipuncture? A. Basilic. B. Median cubital. C. Cephalic. D. Radial. Answer B. The median cubital vein is preferred due to its stability, accessibility, and low complication rate. In infection control, the most effective method for preventing disease transmission is A. Using gloves. B. Wearing masks. C. Hand hygiene. D. Using sterile drapes. Answer C. Hand washing or sanitizing is the most critical step in reducing infection transmission in healthcare. When documenting in a patient's chart, a medical assistant should always A. Use red ink for corrections. B. Use black ink in sign entries. C. Leave blanks for the provider. D. Use pencil for flexibility. Answer B. Permanent black ink ensures legibility, legality, and traceability in medical documentation. A patient refuses a blood draw. What should the CCMA do first? A. Call the physician immediately. B. Respect the patient's decision and document the refusal. C. Continue with procedure to avoid delay. D. Ask another assistant to perform it. Answer B. Patients have the right to refuse, it must be documented, and the provider should be informed. The chain of custody is most important in which type of specimen collection? A. Urine for pregnancy. B. Sputum for infection. C. Drug testing. D. Cholesterol testing. Answer: C. Drug test samples require strict chain of custody to maintain legal integrity of results. Which of the following PPE items must be worn during venipuncture if splashing is possible? A. Mask only. B. Gloves and gown. C. Gloves, mask, and eye protection. D. Gown only. Answer: C. PPE should include gloves, a mask, and goggles if blood splatter or exposure is possible. What is the proper angle of needle insertion for venipuncture? A. 15 to 30 degrees. B. 45 to 60 degrees. C. 5 to 10 degrees. D. 35 to 40 degrees. Answer: A. A 15 to 30 degrees angle allows smooth entry into the vein without puncturing through the opposite wall. A medical assistant notices a patient's blood pressure reads 88/56 mmHg. This may indicate A. Hypertension. B. Hypotension. C. Normal reading. D. Measurement error. Answer: B. A reading below 90/60 mmHg indicates hypotension, requiring further evaluation. Which of the following is considered a CLIA-waived test? A. CBC test. B. Glucose monitoring. C. Blood culture. D. Lipid panel. Answer: B. Glucose testing is CLIA waived because it is simple, low risk, and can be performed in office. The correct needle gauge for adult venipuncture is typically A. 14 to 16 gauge. B. 18 to 20 gauge. C. 21 to 23 gauge. D. 25 to 27 gauge. Answer: C. A 21 to 23 gauge needle provides optimal flow while minimizing vein trauma. The first step in responding to a needlestick injury is to A. Report to the supervisor. B. Wash the area with soap and water. C. Cover it immediately with a bandage. D. Squeeze blood out of the wound. Answer: B. The site should be washed thoroughly before reporting and seeking medical evaluation. HIPAA primarily protects A. Employee benefits. B. Patient privacy and health information. C. Lab test standards. D. Insurance billing timelines. Answer: B. HIPAA ensures confidentiality and secure handling of patients' health data. Which pulse site is used most often to check adult heart rate? A. Brachial. B. Radial. C. Apical. D. Carotid. Answer: B. The radial artery is the most accessible site for routine adult pulse assessment. When labeling a specimen, the medical assistant must include A. Patient initials only. B. Name, DOB, and date time of collection. C. Provider's name only. D. Patient's insurance ID. Answer: B. Proper labeling ensures accurate identification and traceability of the specimen. When administering an intramuscular injection in the deltoid, the maximum volume should not exceed A. 1 milliliter. B. 2 milliliters. C. 3 milliliters. D. 5 milliliters. Answer: A. The deltoid muscle can only safely absorb up to 1 milliliter of medication to avoid pain or damage. A capillary puncture should be avoided on a finger that is A. Warm. B. Cold. C. Calloused or swollen. D. Smooth. Answer: C. Calloused or swollen fingers may cause poor blood flow or sample contamination. When performing CPR, the compression-to-breath ratio for a single rescuer on an adult is A. 15:2, B. 20:2, C. 30:2, D. 10:1. Answer: C. The AHA recommends 30 compressions followed by 2 breaths for single rescuer adult CPR. A patient presenting with tremors, sweating, and dizziness may be experiencing A. Hypertension, B. Hyperglycemia, C. Hypoglycemia, D. Dehydration. Answer: C. Low blood sugar causes shakiness, sweating, and confusion, signs of hypoglycemia. The subjective section of SOAP notes includes A. Physician's observations, B. Patient's reported symptoms, C. Test results, D. Diagnosis. Answer: B. Subjective data refers to symptoms the patient personally experiences and communicates. The primary purpose of using a medical aseptic technique is to A. Create a sterile field, B. Reduce the number of microorganisms, C. Kill all microorganisms, D. Maintain patient comfort. Answer: B. Medical asepsis reduces pathogen levels to prevent infection spread, not eliminate all microbes. Which of the following blood pressure readings is considered normal for an adult? A. 90/50 mmHg, B. 120/80 mmHg, C. 140 to 100 mmHg, D. 130/90 mmHg. Answer: B. 120/80 mmHg is the AHA's standard normal adult blood pressure. Which of the following injections is administered at a 10 to 15 degree angle? A. Intramuscular, B. Subcutaneous, C. Intradermal, D. Intravenous. Answer: C. Intradermal injections are delivered just under the skin surface at a shallow angle. When measuring a patient's oxygen saturation, the device used is called A. Spirometer, B. Sphygmomanometer, C. Pulse oximeter, D. Thermistor. Answer: C. A pulse oximeter measures oxygen saturation, SpO2, by detecting light absorption through the finger. Which of the following is a correct example of medical asepsis? A. Sterilizing surgical instruments, B. Washing hands between patient contacts, C. Using sterile gloves for surgery, D. Autoclaving dressings. Answer: B. Medical asepsis involves reducing microorganisms, while sterilization is surgical asepsis. The main purpose of an encounter form is to A. Record lab results, B. Track services provided for billing, C. Replace consent forms, D. Provide prescription details. Answer: B. Encounter forms list diagnoses, procedures, and charges for accurate billing. Which of the following represents a normal respiratory rate for an adult? A. 8 breaths per minute, B. 12 to 20 breaths per minute, C. 25 to 30 breaths per minute, D. 6 to 10 breaths per minute. Answer: B. The normal adult respiratory range is 12 to 20 breaths per minute under resting conditions. If a patient faints during venipuncture, the first action is to A. Call for emergency help, B. Remove the needle immediately, C. Continue drawing the sample, D. Splash water on the face. Answer: B. The needle must be safely removed to prevent injury before providing assistance. Which document must be signed before performing invasive procedures? A. Insurance form. B. Informed consent. C. HIPAA release. D. Medical order. Answer B. Informed consent ensures the patient understands and agrees to the risks and procedure. The abbreviation BID in a prescription means A. Once daily. B. Twice daily. C. 3 times daily. D. Every 4 hours. Answer B. BID stands for bis in die, meaning twice a day. What is the first action when a fire breaks out in the clinic? A. Run outside. B. Rescue patients in immediate danger. C. Try to extinguish the fire first. D. Pull the alarm and hide. Answer B. Following the race protocol, rescuing individuals in immediate danger is always first. When recording height, it should be measured. A. In inches only. B. Without shoes, standing straight. C. With shoes on. D. In seated position. Answer B. The patient must stand upright, shoes removed, for accurate height measurement. Which color tube is used for coagulation studies? A. Red. B. Blue. C. Green. D. Lavender. Answer B. The blue top tube contains sodium citrate and is used for coagulation testing. The primary function of the medical assistant in patient education is to A. Diagnose illnesses. B. Reinforce provider instructions. C. Prescribe medications. D. Interpret laboratory tests. Answer B. The CCMA reinforces and clarifies provider directions, ensuring patient understanding and compliance.